The majority of GP practices that formed the membership of NHS Barnsley CCG now have some form of patient reference group, which they use to help to engage with their registered patients. No standard model applies, but typically, a PRG comprises of a group of patients who have a particular interest in the services that their GP practice offers. PRGs work alongside their practice to offer their opinions as patients. They can also help their practice to gain views and feedback from their other patients who use the practice on how services could be improved and made more accessible to the wider practice population. One recent example relates to the promotion of Dementia Friends, which is an initiative led nationally by the Alzheimer's Society aimed at trying to make day-to-day life better for people with dementia. Goldthorpe Medical Centre was inspired to become dementia friendly when one of their young patients was diagnosed with dementia. His parents were part of the Goldthorpe PRG, and they found that they could have an impact on their local healthcare services by encouraging the practice to think more about the needs of all of those suffering with dementia.
I'm Leslie from Goldthorpe, and I'm Gareth's mum, a young man with dementia.
I'm Graham from Goldthorpe, obviously, father of Gareth, who has dementia.
And I'm Tony, work at the Goldthorpe Medical Centre, running the patient participation group.
Our local doctor's practice set up a dementia-friendly practice after hearing our story about Gareth, and it made it easy. It's making it easy for people with dementia to come into the surgery and be treated.
Yes, we've found that although there's little we can do for our own particular case, we are hoping that we will spread words so that more people are aware that this terrible illness does not just affect us in our later years. It can affect anyone at any time.
And on hearing your story, that's why we became a dementia-friendly practice. We had the training in-house and we recognise the signs. But yeah, we are known now as a dementia-friendly practice.